Hello students, welcome to AK Sharma Bio classes. In the previous videos, we have studied about the introductory part of reproductive health and population explosion. There are various regions of population explosion in our country. One of the major regions of population explosion in our country is high birth rate. So the regulation of conception or conceiving by a female by preventive methods or devices to limit the number of offsprings in the family is called birth control or contraceptions. Birth control method works on the principle of blocking one of the three major steps or events in the reproductive process. Birth control can be achieved by blocking sperm's transport to the ovum, or we have to stop or we have to check the sperms to meet with the ovum or stop or check fertilization. It can be done by blocking ovulation, the release of ovum from ovary, or it can be achieved by blocking implantation of early embryo in the uterus. So there are three major events which can be checked or blocked by various birth control measures, and such birth control measures are called as contraceptive methods or methods of birth control. There are two main methods of birth control or contraceptive methods. Two contraceptive methods, temporary and permanent. Under temporary method, natural or traditional methods, barrier methods, intrauterine devices, oral contraceptives and injectables come. These methods are considered as temporary methods, and permanent method is surgical method or sterilization or removal of or cutting off vasa deferens in the male and fallopian tube in females. This is known as surgical methods, and this is permanent contraceptive methods. This is not reversible. Let us discuss one by one. First one, natural or traditional method. This is a temporary method of contraception. The purpose of this method is to avoid chance of ovum and a sperm meeting. We have to block the meeting of sperm to the ovum. First one is periodic abstinence, withdrawal or coitus interruptus, or lactational amenorrhea. These are three natural or traditional methods which can block the ovum and a sperm from meeting with each other. Let us see what is periodic abstinence. The main purpose of periodic abstinence is to avoid coitus from day 10 to day 17 of the menstrual cycle, because day 10 to day 17 of menstrual cycle is called fertile period, and during this period there is more probability of contraceptions. So avoid coitus from these days so that conceptions can be prevented. This is known as safe period or period of abstinence. Let us see, 10 to 17th day of the menstrual cycle is called fertile period because ovulation occurs on about 14th day of menstruation. It may differ in different women. Ovum survive for 1 or 2 days, 24 to 48 hours, and sperm remain alive in the fallopian tube and uterus about 3 days. So there is more chances of meeting of a sperm to ovum during this 12 to 17 days. So these days may differ in different women. So better avoid coitus from day 10 to day 17 of menstrual cycle, so that conception to be avoided, to be prevented, or fertilization can be prevented. Second one is withdrawal or coitus interrupts. This is withdrawal of penis from the vagina just before ejaculation to avoid insemination. It involves withdrawal of the penis from the vagina by the male just before ejaculation, so that semen is not deposited in the vagina and there is no fertilization. This method is moderately effective because male produces some lubricating fluid from his Cowper's glands before ejaculation, and that contains many sperms. So this is not effective. This is moderately effective. Third one is lactational amenorrhea. In breastfeeding women, there is less chances of getting conceived. It is the prevention of conception by breastfeeding the child. Ovulation and the menstrual cycle do not occur during the period of lactation. It has no side effect. It is effective up to 6 months after parturition or after the delivery of the child. After childbirth, up to 6 months, this is effective. But there is no menstrual cycle and there is no ovulation in the women up to 6 months of delivery. So this method is considered effective only up to maximum period of 6 months following parturition. Chances of failure of this method are high because this is not completely believable. Next one is barrier method. Here in this, ovum and sperms are prevented from physically meeting with the help of barriers. Example, condoms or condom. There can be male condom and female condom both. It is made up of thin rubber or latex sheath that are used to cover the penis in the male, or it is used to cover vagina and cervix in the female just before coitus, so that the ejaculated semen would not enter into the female reproductive tract. Nirodh is a popular brand of condom for the male. So the common brand provided by Family Welfare Services is Nirodh, and this is a popular brand for condom for the male. This device also provides protections against sexually transmitted disease. Condoms are very popular because it protects the user from sexually transmitted disease and AIDS. It is disposable and it can be self-inserted by the male itself and thereby give privacy to the users. The condom for male and here the condom for females. Let us see some barriers for the females. Diaphragms, cervical caps and vaults. These are also made up of rubber and are inserted into the female reproductive tract to cover the cervix during coitus. These devices block the entry of sperms through the cervix and these are reusable. These fem shield or female condoms, diaphragms, they also protect from the sexually transmitted diseases. Diaphragm is a soft rubber cap with flexible metal or spring ring at the margin which is fitted inside the vagina. It prevents a sperm from reaching the ovum and give a protection against cervical cancer. Cervical caps. It is miniature diaphragm that covers cervix closely. It is fairly effective and can remain in place longer than diaphragms. Valved caps. Valved cap is hemispherical dome-like rubber or plastic cap with a thick rim which is meant for fitting over the vagina, over the cervix. The chemical method. Spermicidal creams, jellies and foams. These can be usually used along with these barriers to increase their contraceptive efficiency. Foam tablets, creams, jellies and pastes are inserted in the vagina before intercourse to prevent sperms from entering the uterus. These contain spermicides such as lactic acid, citric acid, boric acid, and these have spermicidal properties, and this kills the sperms in the cervical canal and in the uterus. These can be used along with diaphragms or cervical caps. Another one is intrauterine devices, IUDs. These are inserted by doctors or expert nurses in the uterus through vagina. This includes non-medicated IUDs, Lippis loops, copper releasing IUDs, example copper T, copper 7, multi-load 375. Copper releasing IUDs increases phagocytosis of sperms within the uterus, and the copper ions released suppress the sperm motility and the fertilizing capacity of the sperms. And third one is hormone releasing IUDs. Progestasert and LNG20 are hormone releasing IUDs. Copper T or copper IUD is commonly called copper T because they have ionized copper which slowly diffuses at the rate of 50 microgram per day, and it has local anti-fertility effect by bringing about release of toxic cytokines. And this device is to be replaced after 3 to 5 years when copper release becomes scanty due to calcium deposition. And hormone releasing IUDs like Progestasert and LNG20 make the uterus unsuitable for implantation and the cervix hostile to the sperm. So sperms are not able to move properly in the uterus. Cervix becomes hostile or attacking to the sperm. Progesterone or estrogen IUDs release hormones that suppress endometrial changes and luteal activity. So IUDs are ideal contraceptives for the female who want to delay pregnancy or who want to give some space between the children, isn't it? But there are some disadvantages of IUDs. Sometimes IUDs are expelled out without the knowledge of the users. It comes out automatically, and risk of perforation or also risk of infection occurs. So there is risk of getting leakage, or sometimes women have infection with this. Sometimes it can cause menstrual bleeding and pain unnecessarily. The fourth one is oral contraceptives. Oral contraceptives are physiological contraceptive devices. These are used in the form of tablets, therefore they are called as pills, oral pills. These pills are taken for 21 days starting with the first 5 days of menstrual cycle. After a gap of 7 days, it has to be repeated. Oral contraceptive pills contain progesterone alone or sometimes a combination of progesterone and estrogen. These are of two types, combined pills and mini pills. Combined pills are mostly used as contraceptive pills, which contain synthetic progesterone and estrogen. Synthetic progesterone and estrogen checks ovulation, and mini pills contains progestin only. So questions arises here, how the oral contraceptive work to prevent contraception. They inhibit ovulation, as we have discussed now. Progesterone and estrogen inhibits ovulation, and it makes endometrium wall unsuitable for implantation, as well as it alters the quality of cervical mucus to prevent entry of the sperms, and sperm's motility is also affected. Pills are very effective with lesser side effect. Pills like Mala D and Mala N are commonly used combined contraceptive pills, and these are taken daily without a break. Saheli, a new oral contraceptive pills for female. It has been developed at Central Drug Research Institute, CDRI, Lucknow. This oral contraceptives contains a non-steroidal preparation called centroman, which is taken once in a week dose for 3 months, and it is a very high contraceptive value with very little side effects. So oral contraceptive pills increases the risk of intravascular clotting. This is one of the major disadvantages of taking oral contraceptive pills. So this may cause the high risk of intravascular clotting, the clotting of blood inside the blood vessels. Therefore, oral contraceptives are not recommended for women with history of disorder of blood clotting, blood vessel damage, hypertension, heart diseases, etc. Next one is injectables. These are the injections of progesterone alone or in combination with estrogen are used by female as injections or implants under the skin. A new contraception which is used by the female under the skin is called implant or norplants. Their mode of action is similar to that of pills, and their effective periods are much longer. And there is emergency pills, and implantation can also be checked by taking progesterone or a combination of progesterone and estrogen or any IUDs within 72 hours of coitus. It becomes very effective to prevent fertilization or implantation, and such pills or such contraceptives are called emergency contraceptives, as they avoid possible pregnancy due to rape or some casual contraceptive failures. Such contraceptives are called emergency contraceptives. It is also called as morning after pills. Now, permanent contraceptive methods, that is surgical methods or sterilization. The purpose is to block gamete transport and thereby prevent conception. Sterilization provides a permanent and sure birth control. Sterilization in male is called vasectomy, and in female it is called pubectomy. In vasectomy, a small part of the vas deferens in male is removed, or it is tied up through a small incision on the scrotum, and the removal of the vas deferens or cutting of vas deferens is called vasectomy in male. In female, This sterilization method is called tubectomy. What is done in this? A small part of the fallopian tube is removed or tied up through a small incision in the abdomen or through vagina, and this is called tubectomy. So there are two surgical methods, which is sterilization method or sure birth control method. In male it is called vasectomy. This is cut off vas deferens, and tubectomy, this is the cut and removal of fallopian tube. So tubectomy, and vas deferens, so called vasectomy. Here we can see here vasectomy in male and tubectomy in female. There are some side effects of contraceptive methods, contraceptive devices. What are those side effects? Let's see. There may be nausea, abdominal pain, breakthrough bleeding, irregular menstrual bleeding, breast cancer. There is one more method for contraception after pregnancy. There is one of the most widely used methods of pregnancy control or fertility control in the world, that is known as medical termination of pregnancy or MTP. This is intentional or voluntary termination of pregnancy before the fetus becomes viable. It's called medical termination of pregnancy or induced abortion. MTP is comparatively safe up to 12 weeks or first trimester of pregnancy. It is one of the most widely used method of fertility control in the world, as we have already discussed. MTP is comparatively safe up to 12 weeks or first trimester of the pregnancy. It becomes very risky after the first trimester, as the fetus becomes intimately associated with maternal tissues. The bonding of maternal tissue and fetus becomes very strong after first trimester, so it becomes very risky when it is tried to abort the fetus after first trimester. During first trimester of pregnancy, misoprostol or prostaglandin along with mifepristone antiprogesterone is an effective combination given to the mother to abort the fetus in the first trimester. Under this act, termination of pregnancy can be done up to 20 weeks if pregnancy is likely to produce congenitally malformed child. If there is any abnormality in the child, it is permitted to terminate the pregnancy or to abort the fetus if there is any abnormality in the fetus, or if the child is the result of any rape or any contraceptive failures and it is likely to harm the mother, then it is permitted to terminate the pregnancy legally under this act, and this is a legal termination of pregnancy, which is called as medical termination of pregnancy, but it has resulted a large scale female feticide, and it brings some complications in the mother due to unsafe abortions in the hands of untrained persons. To prevent such mishappening, the government has enacted a law, Prenatal Diagnostic Techniques Act 1994. It inhibits preconception and prenatal sex determination by amniocentesis. Amniocentesis is being misused by the doctors and the parents to detect the sex of the fetus before its birth. It leads to female feticide. It is now a punishable act with an imprisonment of 5 years